Hello, this is your Congressman Michael Burgess. Today, Obamacare is 1 year old. This marks the 1-year anniversary of the Patient Protection and Affordable Care Act being signed into law. As a doctor, I'm the first to admit that we needed reform in America's healthcare system, but the way that the last Congress and the President's approach simply did not fix that which needed to be fixed. So what do? You get a system where you'll pay more and get less. When the debate on health reform heated up in 2009, the American people made it very clear: give us reform that will fix our problems and leave what is working alone. President Obama even seemed to be listening as he stated over and over, if you like your health care, you can keep it. We all know that his statement was simply not true, and we are left with an even bigger mess than ever before. The American people wanted reform. What they did not want was a 2,409-page bill that shatters a system that was arguably working well for 2/3 of the country. Instead, what Congress should have done was tackle the problems of the 1/3 of Americans who needed help. Insurance reform is where we could have made the greatest impact. We could have eliminated the bias against patients with pre-existing conditions, prohibited rescissions except in cases of fraud, and ensured that states have well-designed high-risk pools. Instead, we've created a new entitlement that will saddle future generations with debt due to its unsustainable nature. If the health care law was only about pre-existing conditions and letting kids stay on their parents' insurance, why was the bill over 2,000 pages long? We could have accomplished this in a standalone bill at a much lower cost. Another area of reform that should have been fixed was medical liability. The success of Texas 2003 reforms is a model that America can use across the country. Texas has licensed over 15,000 new doctors, and Texas hospitals have delivered almost $600 million in charity care. Texas has shown what can really work. As a result, I've introduced the Medical Justice Act into Congress. As Texas continues to lead the way, I hope the federal government can take what we have done in Texas and put it to use all across the country. Finally, the current formula that Medicare uses to pay doctors is unstable, and a permanent fix is needed to ensure that seniors have access to their doctors. The sustainable growth rate, known as the SGR, was not fixed or even an attempt at fixing it in the healthcare law. Congress must undertake the fix of the SGR and do it permanently. To do this, the Senate and the House must work together right from the start. We're seeing that the new healthcare law is not what the American people want. 28 states have challenged the law in court, saying it violates our constitutional rights. Judge Vinson in Florida has declared that the individual mandate in Section 1501 is unconstitutional, and in fact it cannot be severed from the law because of its centrality to the entire insurance market reform that was created in the healthcare law. In addition, Health and Human Services Secretary Kathleen Sebelius has handed out nearly 1,000 waivers to allow select companies, unions, and even whole states to escape, at least temporarily, some of the burdensome new insurance rules that the healthcare law has created. The bottom line is that if the healthcare law fixed existing problems, waivers would not be needed, states would not be challenging the law, and 2/3 of the population would be able to do, as President Obama stated when he took office, if you like your healthcare coverage, you can keep it. Insurance reform, medical liability reform, and fixing the SGR are only 3 of the areas that I believe should have been included if Congress was truly interested in helping the healthcare system. Additional ideas can be found on my website, burgess.house.gov. Thank you for your time. God bless you and your family, and God bless Texas.